Okay, good afternoon everybody, this is Steph from Surgery App. Welcome to another live webinar. Thanks for joining us again. In today's session, we'll be going over push notifications. You can send push notifications to your practice population or cluster population. We'll be going over both today to entire populations, groups or cohorts of patients, and also individual patients. So we're going to share screen now as usual and dive into the presentation straight away. Okay, so here we are in the web portal view of the app. And again, we've got Grange Road Surgery as our test bed for these push notifications. So notifications, when you go into your portal, you'll see at the left-hand side menu down here, you'll see push notifications are down here. Now, the first thing you come to are notification templates. So these are templates which you would you can use as the name suggests, templates which you can use time and time again and edit them. So we've got a template here that if I was back in practice management, I would use quite often, which is closed for staff training. Now, if I want to edit that at any time, that's there and editable. So we've made it so that it says we will close from 1 p.m. to Wednesday. The date open again at 8 a.m. on a date. And during these times, please use the 111 out of hours service. That's also been translated into Welsh. So these are templates which you can create for yourselves, which are templates you can be using quite regularly. To create a new one, simply click on Add New, put a title, put some content, click on Save, and then those templates will always appear here for you. Then when you click on Send Notifications, and click on this, then the templates, your practice-specific templates, you can see here, we've got one here, that will appear automatically. And if you want to use that, you can click on Use, simply click on that, and then click on Send, and then that sends that to the whole entire practice population. So if I go into the app now and I refresh, that notifications come through on my phone and on my Apple Watch. And if I click on refresh, if I open the notification on my phone, there is closed staff training and the message is there for patients. So that's a very simple way of sending notifications to your patients about anything. You don't need to have templates. If you simply wanted to send a quick notification to patients to say, our phone lines are down, please bear with us, you can just send that out. And then that's sent. And again, if I refresh the app now, that notification comes through and you've told the whole of your practice population that your phone lines are down and you're working on it. So that's it at its very basic form, how you can send notifications to patients. Again, you can do this on a cluster-wide basis or on a practice basis. When you log in as a practice manager, you will see this. If you log in as a cluster lead, if I log in very quickly as a cluster lead, then this is me as a cluster lead for Grange GP cluster. I can send notifications then in exactly the same way, but across an entire cluster population. For example, if we wanted to get some feedback from patients, patient survey, you can change that to cluster survey, and we can link that then into a cluster survey, which we would help to build for you. You can either do that on Microsoft Forms, Google Forms, SurveyMonkey, whatever platform you're using to do surveys, we can send that. And that's gone out now to every patient in your cluster. So you've got 5 or 6 or 7 practices or 12 practices in your cluster. Doesn't matter. The cluster manager sent that notification out. It's gone to everybody. So let's just log back in now as if you were a practice manager. So we can send notifications to groups of patients. So for example, this would work well for patients who are eligible for flu vaccines or for the any catch-up campaigns, or patients who may need medication reviews. If we go into app users here, EMIS, Vision and Informatica will have a list of what you need to upload. So we can upload a CSV form and tag users. So let's go for flu, eligible for flu. Let's say we've downloaded a list of app users eligible for flu from Informatica, Vision, EMIS, or in England System 1. We can then choose a file I know I have a test file on my desktop here called test users. So I'm going to now upload that file. Once it's uploaded, it will search for users who have the app based on their first name, surname, and date of birth, and tag those patients. Upload and save tags. Okay, so we can see now that the patients, some patients have been tagged as eligible for flu, others haven't. So it only looks for patients who are eligible for flu. Then when we send a notification out to patients, send a notification, we can click on, for example, flu vaccines are now available. We can link, if you wanted to a patient information page we can help you build to tell patients all about how to book, listing clinics, when your flu clinics are on. We can build that, or you can just say in the message, please call to book. Whatever it may be, you can instruct your patients who are eligible, the over 60s, the over 65s, under 65s of the Athletics Register, any children, that list from Informatica or Vision will be sent out. And then it's sent down here, instead of sending to all users, we can then narrow down. There are seven patients who have been eligible, been tagged as eligible for flu. We can send that out, and then that will go to those specific patients only, inviting them in for a flu vaccine. And now I've tagged myself as eligible, so when it comes through to me, this is what it would look like. There we are. So, and you can link that to a form, or, as I said, a patient information page, because we can link notifications to absolutely anything. So, for example, if you're running a patient survey, we can link it to your patient survey. If you want more patients to sign up for online services, you can run searches in Vision or Informatica and EMIS to find out who hasn't signed up for My Health Online, and you can target those patients then with the online registration form. You can send patient information pages. You can link to news posts. You can link to what's on posts. So if we have in the app, let's see what we have. As example, we've got a flu clinic from the 29th of January. We can send patients flu clinic. Click below for details. We can put it onto a what's on post, flu clinic, and again, you can either send that to everybody, or you can send that to the patients who are eligible only for flu. Send. So you're really targeting those patients there, and when that invitation comes through, or notification rather, there we are, read more. It opens up that entry then in the calendar, and you can tell patients flu vaccine now in stock, call to book or email to book, and we can build that. If you wanted us, we can do that for you. We can build that entry for you, listing all your clinic dates, arrangements, or what you want to communicate to patients. So that's a really good way of doing it. And don't forget, you've got a full audit trail here. So when you click on Audit Trail, any notifications sent out by you, there we are, it'll list today's date and time, the date and time it was sent out, and which list it was sent, and the actual content of the title and the content of the notifications. You've got a full audit trail there to say, okay, well, how many patients did I send it to? How many of those patients actively looked or opened that notification? There's one other thing you can do in notifications, and that's target individual patients. So you'll see here when you go into app users, there's a bell icon here with notify. That means you can send a notification to that individual patient. So let's concentrate on me. Let's say I've been a naughty boy and I'm on some sort of medication, and I'm not compliant with medication reviews. So you could send a title medication review required. You can put whatever you want, please complete form and book bloods. You can then link that to a form that we build for you, or an information page specific to that patient. For example, a form, let's link it to a medication review form. We don't seem to have one here as an example, but you could link it to any kind of form you wanted to send out, like I'll say HRT medication request. Okay, we link it to that, but the form is only being sent to that individual user, and you can send that through to that patient, and that's gone. Again, in the audit trail, there's a full audit trail there to say which user it's gone to. with the title and the content of the notification, and then when I refresh that, obviously it's going to come through to me only, and it's telling me that I need a medication review. Please complete and book bloods, and there's read more there, and then a form comes through for me to complete. So you can really target individual patients, cohorts of patients, and your general population with information very, very quickly. And as we said, there's no charge for sending out these notifications. They're free of charge, but it can really help you to do things on a practice and a cluster-wide basis through push notifications, really. I think that's covered everything regarding notifications. Let's see a few other examples you could send, particularly around COVID vaccinations. I know a lot of patients have had, a lot of surgeries have had a high prevalence of calls from patients requesting information around COVID. Well, again, when it rears its ugly head, isn't it? Maybe next year when we get busy again with vaccinations, or with what we find out what's going on, you can tell patients COVID vaccine update. You can put that, and you can say click below for more details. And then again, then we can build an information page linking to a page. Open that up. We can link to COVID-19 vaccine information. We can send that to all users. That can tell patients that you are not doing vaccines in practice. The health board are administrating all of your vaccines. Once that comes through, we can refresh, and the patients can see that notification. COVID vaccine update, click below for more, read more, and then it takes into the information page that we can build for you. We can link to the Welsh Government updates, we can link to COVID passport, we can link to any booking forms or booking systems that the health board are running. We can link to the mass vaccination centres or the walking groups. Any information you want to provide, you can send that out, and that can be sent. That could be a good one to be sent out as a cluster. Your cluster lead, we could build an information page for your cluster, and we can send that out across the entire cluster to say that the surgeries are not running boosters; they're all being done by the health board. And again, that doesn't cost you a penny to send out. And you have a full audit trail then to say when it's been sent and how many patients it's been sent to and how many opened it. Okay, so that's it on the push notifications. I hope this has been informative for you. As always, this video, I'll stop sharing now. As always, this video has been recorded, so it will be sent out to all practice managers. If you have any questions, please put it in the comments now. I know there is a slight delay in, I think about a 3-second delay in this, so put your questions there, and I'd be more than happy to answer for you. But this video will be sent out, so you can play it back, pause it and play it whenever you want. Okay, so no questions. So that draws an end to this session. Thank you for attending. This will be sent out by email, a recording of this, and we advise you of the content of the next webinar next Wednesday. I think in that we'll go over what we've got 15 app updates being issued. We're working on that at the moment. We're beta testing the second week in February. So I think in the next session we'll go over all of those app updates and a couple of other things which we're introducing into the app. Okay, thank you all.